Thank you, April. We would like to take the space to share our own territorial and land acknowledgements in order to situate us in the relationship to the land that we share. If you're comfortable, we would love to hear from you and encourage you to introduce yourself. Territorial acknowledgement in the chat function. My name is Kristen Jordan. I'm a Cree Irish woman, and I'm speaking to you today from the traditional territory of the First Nations and Métis people who have lived and cared for this land for generations. Treaty 6 encompasses a rich tapestry of cultures, history, and language, and we honor diverse Indigenous communities, including the Cree, Blackfoot, and Dene, who continue to contribute to the vitality of this land.
Thank you so much, Kristen. So my name is Kayla Tremblay, and I'm speaking to you today as a guest in the lands of Ukdamguk, also referred to as the island of Newfoundland. So Ukdamguk is the ancestral territory of the Beothuk, who were a distinct Indigenous nation and whose spirits remain only in story after the expansion of English and French colonization efforts in Ukdamguk. I'm also speaking to you today from the traditional territory of the Mi'kmaq. So as we reflect on our shared history, we recognize the ongoing impacts of colonization and also the importance of truthful reconciliation. We commit to fostering respectful relationships, understanding, and collaboration with Indigenous peoples, and to honoring the treaties that were made. May we work together towards a future that's built on mutual respect and shared stewardship of this land.
Thank you, Kayla. So again, my name is Kristen Jordan, and I am a Cree Irish woman. I accepted a position with the Red Cross in May of 2024, and I have been given the absolute honor of presenting the work completed by the Indigenous Peoples Help Desk on OHR to this wonderful audience today.
And welcome, everyone. As I mentioned, my name is Kayla Tremblay. I am a guest in this territory. My ancestors come from Ireland, France, and Norway. I have been with the Canadian Red Cross in various capacities for 4 years now. So while Kristen and I both have professional experience in the field of opioid harm reduction, we also have a personal attachment to the work that we do in our roles outside of the Canadian Red Cross. So Kristen and I are drawn to this work because we know that together we can all contribute to making this world a better place for both our children and the children that we have the privilege of knowing and supporting in our lives. So in my life outside of work, I am a mother to that beautiful baby girl there on the right-hand side of the screen. Her name is Della Rose. She's a lot bigger now. That was taken about a year ago. I am also a dog mom, a sister, an auntie, and a friend. And in the interest of being vulnerable with all 100 of you today, I am also a closet karaoke enthusiast, as well as a not so great guitar player, but I continue to learn because it brings me joy. What about you, Kristen?
Well, from the picture, you can tell I'm the mother of 2 beautiful children, my son Maddox and my little baby princess Isla Grace. I'm a foster mom for 12 different animal shelters in my province of Saskatchewan. And in my spare time, I train PTSD dogs. I come from a long line of farmers, and I still farm our family farm today. I've been a social worker for 18 years in the front lines with Indigenous communities. And that wraps me up. So welcome, everyone. We are thrilled to have you join us today for this information webinar. Thank you for taking the time to be here. We are delighted to have you join us from across Canada, whether you're tuning in from the bustling streets of Toronto, the scenic landscapes of British Columbia, or anywhere in between. Your presence enriches this conversation. Today, we will be discussing opioid harm reduction and services provided by the Indigenous Peoples Help Desk to address this crisis. We have some valuable information and insights to share with you. Our goal is to provide you with information you need to develop basic knowledge of how to best support opiate harm reduction, or OHR, across Canada's provinces and territories, including different approaches and supports nationwide. Please feel free again to use the chat to ask questions or share your thoughts through the presentation, as the webinars that continue from here will also have time set aside for roundtable discussions. So don't hesitate to jot down your questions for those roundtable discussions later on. Let's get started.
Thank you, Kristen. So let's go over some of our learning goals for today's webinar. So first, we want to situate the landscape of the current opioid crisis in Canada and use a demographic lens to explore which areas of Canada are feeling the most impact. We will speak briefly about Naloxone, which is a life-saving medication that reverses the impacts of opioids during an opioid poisoning. And we will highlight this in a lot more detail on our third webinar in the series. So please make sure you register for this webinar to learn more. We would like you to have increased awareness of the opioid harm reduction resources, tools, and support provided by our teams at the Indigenous Peoples Help Desk. And overall, we would like you to come away from this webinar with information, tools, and resources, but we would also like you to come away with a genuine curiosity, as well as a renewed sense of empathy and support for those struggling with opioid misuse. I also would like to share about what we are speaking about in the next series of webinars in the interest of making this space as safe as possible for those who join us on this journey. So when we speak about topics like the opioid crisis and harm reduction, naturally these conversations gravitate towards topics like depression, grief, loss, trauma, and ultimately addiction, and all that encompasses this experience. So we understand that while this is a really important conversation, this is also a deeply personal and vulnerable and sensitive topic that can bring up a lot of complicated emotions, especially for those of us who have firsthand experiences with these subjects. So please take a moment now to check in with yourself. Ask yourself, am I in a good headspace to hear this conversation today? And also, I hope you can think about who I can reach out to for support if I need it. So we've attached a few national resources that are easily accessible to you via phone call, email, or text, whichever is more comfortable for you. Please don't hesitate to use these resources if you need them. April will be dropping these lines in the chat. We would also like to issue a disclaimer that the content that we share with you today is both for informational and educational purposes only. It is not intended to take the place of medical or professional advice. So we encourage you after this webinar to do your own research about local laws and policies that govern harm reduction in your community. If you need immediate assistance or support, please contact your local EMS or police services. And now it's my honor to pass this over to Kristen, who will be speaking about her experience working within the context of the opioid crisis.
Thank you so much, Kayla. During my time as a volunteer in a somewhat isolated community in Saskatchewan, I had the privilege of meeting Margaret, a remarkable 76-year-old woman. Her story is a reflection of challenges faced by many older adults living in rural areas, particularly regarding chronic pain and the complexities of addiction. In a community where resources are limited and healthcare access is often a struggle, Margaret's experience shed light on the critical need for support and understanding for those navigating similar battles. Through our conversations, I learned not only about her personal journey, but also about the broader issues affecting individuals in remote regions, reminding me of the importance of connection and compassion in addressing these pressing concerns. Before I share these stories, I would like to mention that all names and personal information have been changed to protect the individuals. Margaret, a 76-year-old woman, suffered from chronic arthritis pain and opted for hip surgery, which initially provided relief. After surgery, she was prescribed opioids to manage her post-operative pain. However, as her prescription ran out, she faced significant challenges. The hospital was far from her home, and she had no means of transportation for follow-up care or physical therapy. Her insurance did not cover alternative pain management options. With pain returning, Margaret began sourcing pills from friends online, believing she was simply managing her discomfort. This reliance on opioids grew, leading to social withdrawal and emotional distress. Her children lived far away, and she felt ashamed to disclose her struggles, which deepened her isolation. During a visit, her daughter Emily noticed the changes in Margaret's behavior and appearance. Despite Emily's concern, Margaret insisted she was fine and continued to use opioids. Over time, her addiction worsened, leading to a cycle of temporary relief followed by increased despair. Margaret's situation underscores the complexity of addiction among older adults, particularly the lack of accessible resources for pain management and addiction treatment. Her story illustrates the need for better support systems for seniors facing similar challenges. As we shift our focus from Margaret's story to that of young Mia's story begins with her living in an urban area. We see how demographic factors significantly influence the experience of pain management, addiction, and available supports. This transition illustrates how age, geographic location, and available resources can shape the paths individuals take in dealing with pain and addiction, highlighting the need for tailored approaches to support people from different backgrounds. In my role at a local school, I had the opportunity to work closely with Mia, a bright, resilient teenager navigating the challenges of adolescence. As she faced mounting pressures from school and life at home, it became clear that she was at risk of turning to substance abuse as a coping mechanism. Recognizing the signs early on, I committed to supporting her in finding resources and building a strong support network. Mia's story is one of perseverance and growth, illustrating the importance of early intervention and the power of community in helping young people avoid the pitfalls of addiction. Through our collaborative efforts, we aim to empower Mia to make healthier choices and embrace her potential. As a social worker supporting students on an urban Indigenous reserve, I often witness the resilience and challenges young people face, and Mia was one notable case. She was a 15-year-old who struggled with depression and isolation. Despite being a bright student, Mia became withdrawn after losing a close family member to addiction, which intensified her anxiety. During a group session, Mia shared, "I feel like I'm drowning. I just don't fit in. And it's hard when I'm dealing with so much." During that group, Mia also disclosed she had been experimenting with opioids. Together, we explored coping strategies. I connected her with the school's counseling resource and a peer support group to focus on her mental health. This group helped Mia realize many of her classmates faced similar challenges and fostered a sense of belonging. We also discussed the importance of cultural identity. Mia began to engage with local elders and participated in traditional practices that provided comfort. At a cultural event, I witnessed a transformation in her as she joined in a traditional dance, her smile returning and her spirit shining. Mia's story highlights the resilience of Indigenous youth and the vital role of social work empowering them to overcome adversity and thrive. By providing a support system, we aim to steer her away from the dangers and towards healthier choices. Thank you, Kayla.
Thank you so much, Kristen, for sharing these stories, which highlight the true complexity of this opioid crisis and provides us with a framework to situate our next section. So throughout our webinar today, we will be breaking up the information that we're speaking about with some questions related to the opioid crisis in Canada. We believe that the more you're made aware of the circumstances surrounding opioid use, the easier it will be to both reduce the stigma and provide accurate information. So how it's going to work is I will read off the question and you will see a poll pop up with the answers on the screen. So please select the answer that best reflects your guess and we will discuss these answers afterwards. So for our first question, in which year did opioid addiction begin to be recognized as a major crisis in Canada, leading to a widespread public health response? Is it 2005, 2010, 2016, or 2020? Feel free to put your responses in this pop-up here. There might be a little bit of a delay, but once we get our answers back, we will discuss them. And thank you so much to everybody for introducing yourselves in the chat. I can see that we have so many beautiful people joining us from all across. So thank you. All right, 2005, 2010. Okay, so you should be able to see the distribution of answers. So 12% of us said 2005, 33% said 2010, 37% said 2016, and 17% said 2020. So thank you so much, everybody, for your responses. If you were in the category of people who selected C, you would be correct. So the Government of Canada declared a public health emergency over opioid use in January of 2016. So this declaration was sparked by a significant uptick in opioid-related deaths and hospitalizations, in particular due to the rising prevalence of fentanyl and other synthetic opioids. We also feel like it's important to note that the COVID-19 pandemic has significantly impacted opioid use in Canada for several reasons. Disruptions in addiction services and harm reduction programs made it difficult for people to seek help during lockdown. Also, the economic stress and mental health challenges faced by many during lockdowns further exacerbated substance use. So thank you so much, everyone, for participating. Now let's move on to our next question. So for our second question, which of the following is not classified as an opioid? Do we have A, morphine, B, oxycodone, C, ibuprofen, or D, fentanyl? I'm excited to see everybody's answers here in just a few seconds. I feel like we should play some Jeopardy music in the background. Do, 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 do. All right, everyone, thank you so much for submitting your answers. 4% of you said morphine, 1% of you said oxycodone, 1% of you said fentanyl, and 93% of you said ibuprofen. For those of you in the majority, you are correct. The answer is C, ibuprofen. So morphine is a strong opioid pain reliever used to treat severe pain, usually prescribed after surgery or for chronic pain conditions. Oxycodone is an opioid medication that manages moderate to severe pain related to post-surgery, injury-related pain, or other chronic pain disorders. Ibuprofen, which was the correct answer, is an over-the-counter anti-inflammatory drug that reduces pain, inflammation, and fever, but it does not bind to the same receptors in the brain that opioids do. It's metabolized quite differently. And finally, fentanyl is a powerful synthetic opioid that is often used for patients undergoing cancer treatment or those undergoing surgery. Fentanyl is significantly more potent than morphine or oxycodone. Thank you, everybody, for participating. Now I will pass this off to Kristen, who will be speaking about opioid harm reduction. Kristen, over to you.
Thank you so much, Kayla. Opioid harm reduction refers to a set of strategies aimed at minimizing the negative health, social, and legal impacts associated with opioid use, particularly for individuals who are at risk of addiction or overdose. These approaches focus on keeping people safe and healthy rather than solely trying to eliminate drug use. Key components include access to naloxone, providing naloxone, an opioid overdose reversal medication, to users, their families, and friends can save lives during an overdose. Safe consumption sites. These are supervised space where individuals can use opioids in a controlled environment with medical staff present to prevent overdoses and provide immediate care if needed. syringe exchange programs. These programs help reduce the spread of infectious disease by providing clean syringes and safe disposal options, promoting safer injection practices. Education and awareness. Informing users about the risk of opioid use, safe practices, and overdose prevention can empower them to make informed choices. Access to treatment. Offering pathways to addiction treatment, including medication-assisted treatment, or MAT, counseling, and supporting individuals in managing their substance use. Finally, community support. Building support networks helps individuals feel connected, reduces stigma, and makes it easier for them to seek help. Overall, opioid harm reduction recognizes that while some individuals may continue to use opioids, we can still take steps to minimizing the risks and supporting their health and well-being. I will now pass this over to Kayla to bring us through another check-in.
Thank you so much, Kristen. So our next question is, which age group has seen the highest rates of opioid-related deaths in Canada? A, 15 to 24 years of age, B, 25 to 34 years of age, C, 35 to 54, or D, 55 years or older. Please submit your best guess and we will discuss this answer shortly. I see we have a couple more introductions in the chat. Thank you so much for giving that to us. Okay, so the results have come in. 20% of you folks said 15 to 24 years. 54% of you said 25 to 34. 24% of you said 35 to 54. And 2% of you said 55 years or older. So the correct answer is C, 35 to 54 years. So according to the Government of Canada's recent reporting on the opioid crisis, most accidental opioid deaths occurred amongst individuals aged 30 to 39 years from January to March of 2024. While this can't all be explained by one specific factor, it can be explained by several factors. So the individuals in this age category are more likely to suffer from chronic pain, which can lead to higher opioid prescriptions or availability. This age category tends to take multiple medications, which increases the risk of interaction with opioids and other medication. Of course, we can mention as well that there are other psychosocial factors that might explain this predisposition, things like everyday mental health challenges, life stressors, career or family responsibilities that may lead to increased efforts to self-medicate. So there is that demographic pattern that shows that those in the 35 to 54 year age bracket are experiencing on average more accidental death related to opioid misuse. Now let's go into our next check-in. So now that we've addressed how age impacts the opioid crisis, let's talk about how the opioid crisis is impacted by gender. So the question is, in Canada, which gender is more commonly impacted or affected by opioid misuse? A, female, B, male, C, gender non-binary, or D, all genders equally? Please select the response that best represents your guess. Perfect. Thank you, everybody, for your response. So we have 12% of you said female, 60% of you that said male, 4% of you said gender non-binary, and 23% of you said all genders equally. Thank you so much for submitting your responses. The answer is male, B. So according to the Government of Canada's recent reporting on the opioid crisis, most accidental opioid-related deaths occurred amongst males between January to March of 2024 at 72%. So while there are nuanced psychosocial factors that impact all gender categories that we see here, the impact is largely felt by the male gender. And this can be due to several key factors. So historically, men have higher rates of substance use and engage more frequently with risk-taking behaviors, which can make them more likely to experiment with opioids and potentially mix multiple substances. Males also tend to work in physically demanding occupations, which can increase their likelihood of both workplace injury and a need for pain management, which can expose them to risk of opioid misuse. Historically, in Western countries, we often see certain societal expectations around masculinity as a concept, which can alienate or discourage men from seeking help for substance abuse issues or mental health challenges. So to be clear, this is not to say that there aren't gendered risk factors in all categories of our gender map. This is just to acknowledge that the opioid crisis has a disproportionate impact on those who align with the male gender category. Thank you everyone for your participation. And now I will pass this over to Kristen, who will speak about why opioid harm reduction is so critical. Thank you.
I would like to take a moment and share with you why this work is so critical. Some absolutely astonishing numbers, pardon me, that are taken from the Government of Canada website from January to March of 2024. So keep in mind, these are statistics from just 3 months. 1,906 apparent opioid toxicity deaths. That is 21 deaths per day on average. 1,505 opioid-related poisoning hospitalizations. That is 17 hospitalizations per day on average. Again, we noticed this map from the Public Health Agency of Canada, and just want to remind everyone that it is only from the first 3 months. There were 6,742 opioid-related poisonings requiring emergency department visits. That is 75 ED visits per day on average. There were 8,719 emergency medical services, EMS responses to suspected opioid-related overdoses. That is 96 EMS responses per day on average. In 2023, stats tell a growing story of the crisis. 8,480 reported deaths. From this mapping, you can see that Yukon, Alberta, Saskatchewan, and Manitoba have more than 20 health per 100,000 people. Ontario, the most highly populated province, had 2,647 reported deaths. That's the highest in the country. And back over to Kayla for another check-in.
Thank you so much, Kristen, for walking us through those statistics. So for our next question, which geographic area in Canada has been most impacted by the opioid crisis? Is it A, Northern Territories, B, urban centers, C, suburban areas, or D, rural regions? Please select the answer that best reflects your guess. All right. The responses are coming in. So 15% of you folks chose Northern Territories, 67% urban centers, 5% suburban areas, and 13% rural regions. So the majority of us chose the right answer, which is B, urban centers. So the opioid crisis disproportionately impacts urban centers due to several factors. So there is a noted higher population density, and that increases interactions with both high-risk environments and also makes illegal and street opioids more accessible on average. While urban centers offer more in terms of resources, they also produce more high cost of living and other socioeconomic challenges, which can lead to higher rates of substance use. The complexity of urban populations can strain public health systems, which can make it difficult to provide adequate long-term harm reduction and treatment services, which further exacerbates this crisis. So now let's shift gears to talk about what we at the Canadian Red Cross have been doing to respond to the opioid crisis in community. So among the work that we're currently doing at the Canadian Red Cross, we are also collaborating with other vested partners to establish a network of resources and training because we know that together we can make that difference. So the Canadian Red Cross received funding from Health Canada's Substance Use and Addictions Programming to team up with St. John's Ambulance to deliver opioid poisoning response training across all provinces and territories, with the exception of Quebec, who already have similar programming in place. So as part of this agreement, they'll create systems to ensure that communities outside of Quebec have access to naloxone, which is a life-saving medication that temporarily reverses the effects of opioid poisoning. A large focus of this project is to reach those at risk for opioid poisoning in underserved, remote, rural, and Indigenous communities, as well as people that work alongside these communities, like shelter workers, harm reduction center workers, emergency and disaster responders, school teachers, and so on. So this initiative aims to equip communities with the knowledge and tools that they need to effectively respond to opioid emergencies and potentially save lives in their community. Now let's go over to Kristen, who will be walking us through a resource that we have been developing, which is called the Opioid Harm Reduction Toolkit.
Thank you so much, Kayla. The Opioid Harm Reduction Toolkit helps communities better prepare for and respond to the opioid crisis. The Canadian Red Cross can support your community through our Help Desk for Indigenous Leadership. This Opioid Harm Reduction Toolkit is designed to support existing community tools. The toolkit includes both federal and provincial resources. They can be tailored further for unique community needs. The kit items will include marketing and awareness, emergency opioid response and preparedness, training and education, and naloxone access. Use the QR code on your screen or the URL in the chat to view our Manitoba kit. We will also share links for the Alberta and Ontario toolkits in the chat. An initial provincial or territorial-based kit can be sent rapidly for immediate support, with further customization completed through collaboration, development based on unique identified community needs. Currently, we have Ontario, Manitoba, and Alberta toolkits ready for community use. The remaining provincial and territorial toolkits will be ready prior to the end of 2024. Contact the Indigenous Programs team for more information. We will share the contact information in a couple of minutes. While there are similarities across the country, we are collecting resources that meet unique needs of each province and territory. Each toolkit has national and provincial resources, as well as current CRC training opportunities and printable opioid harm reduction resources. However, each region has a unique way of supporting this national crisis, as each province is responsible for healthcare, provincial programs, and supports will vary. Additionally, Indigenous organizations have unique programs and support across the country. These regional programs and Indigenous organizations are described in each toolkit. The toolkit is available via a user-friendly virtual platform that can be viewed on a mobile device, laptop, and desktop. Individuals have the ability to track progress through the toolkit and revisit chapters and resources that were previously viewed. CRC staff will continue to update and add new information to the virtual toolkits when you use the QR code or the URL link for your provincial or territorial. You will access the most up-to-date versions of that toolkit. The Help Desk for Indigenous Leadership can support your community with printable and mailable resources, in-person and virtual training, templates, videos, and community support calls. Now, I will like to hand it over to Kayla to discuss naloxone in greater detail.
Thank you so much, Kristen, for walking through our opioid harm reduction toolkits. So let's talk about naloxone. As a reminder, our third webinar on November 26th at 1 to 2 Eastern Standard Time will unpack naloxone in a lot more detail. But for now, I will give a brief overview of what naloxone is and how it affects the brain during an opioid poisoning. So naloxone is a life-saving medication that rapidly reverses the effects of opioid poisoning until the person can receive professional medical care. Naloxone is what is called an opioid antagonist, which means that it blocks the effects of opioid on the brain through binding to the same receptors. It can be administered as both an injection or a nasal spray, making it easy to use in emergency situations. So how does naloxone work? When someone is experiencing opioid poisoning, one of the main risk factors of accidental death is that their breathing slows down or stops, because opioids bind to receptors in areas of the brain that are responsible for breathing. So this binding reduces the brain's ability to send signals to the body to breathe, which leads to respiratory depression. Naloxone works quickly by binding itself to the same receptors, which displaces the opioids. So we just spoke about slowed breathing as a sign of opioid poisoning. So let's talk about some of the other indicators that somebody may be experiencing opioid poisoning. So you're going to want to listen for choking or snoring sounds because these sounds can indicate airway obstruction. You might also see extreme drowsiness or unresponsiveness. So the person may be unconscious or unable to wake up even when you shout their name or try to shake them gently. They may also have pale, clammy skin or a bluish tint, especially around the lips or the fingertips. This indicates a lack of oxygen. You will also see small pupils, so the black parts around our eyes. It's often described as pinpoint pupils, where the black part of our eyes are quite small and restricted. You can also look for clues around you and the person, including paraphernalia, needles, or pill bottles, which may cause you to suspect opioid poisoning. If you come across someone who you suspect is experiencing opioid poisoning, be sure to call your local emergency services or 911 immediately. So let's have another check-in question. Now that we know what naloxone is, let's talk about where we can find it. So in Canada, naloxone is available over the counter at which of the following places? Pharmacies, pharmacies, hospitals only, schools only, or only through specialized clinics. Please select your answer, and we'll talk about this after. And again, I would also like to reiterate that our third webinar of the series goes over naloxone in much more detail. So if you haven't already signed up for it, please do. There will be a lot of really important information. Okay, I see the responses coming through. Thank you so much. 81% of you folks chose pharmacies, 5% hospital, 0% schools, and 14% is only through specialized clinic. So you are in the majority. If you chose the answer pharmacies, you are correct. So although you may find over-the-counter naloxone kits in hospitals and in schools, the best place to find it is pharmacies. So naloxone is available at pharmacies to enhance public health and safety by providing both free and immediate barrier-free access. So with the rising rates of opioid misuse, making naloxone widely accessible empowers individuals, families, and communities to respond effectively in emergencies. So by stocking naloxone, pharmacies really do play that crucial role in harm reduction efforts, helping to reduce fatalities and encourage those affected by addiction to seek further treatment and support. So the next time you're at your pharmacy, why not ask for your own naloxone kit that you can carry? Even carrying it with you is an act of harm reduction and community safety. So thank you so much for choosing to spend your time with us today, and a gracious thank you to my co-facilitator, Kristen, for bringing her passion and energy into this webinar series. I will pass this back to April to wrap up our webinar today and go into our Q&A session. April, over to you.
Thank you so much, everybody. And thank you, Kristen and Kayla, for your wonderful presentation. And just before we go into our Q&A, we wanted to share more about our series. And there are 3 remaining webinars over the fall, and we're hosting our next webinar titled Opioid Harm Reduction Community Overview Tool on Tuesday, November 12th from 1 p.m. to 2 p.m. Eastern Standard Time, or 11 to 12 Pacific Time. You can register by following the QR codes on your screen or by visiting the links in the chat that we will share again. And any questions you have for us, you can also email us at rrr@redcross.ca. So now we'll be going into our Q&A. And so if you have questions for us, just to make sure that your question does get seen, please use the Q&A box in your control panel. If you use the chat, we may not be able to see it. So let's see what we have so far for our presenters. So we have one question from somebody who asks, I would like to become an OHR champion. So how can I achieve this?
Well, I think for that person, there would be a couple of different things to do. I would highly recommend continuing on with this webinar series, understanding everything that the Indigenous Peoples Help Desk has to offer. So attending our Opioid Harm Reduction Community Overview Toolkit webinar, our information session on naloxone, and also learning from our Indigenous communities, as oftentimes our Indigenous communities have different ways of going about handling these types of crises. The Canadian Red Cross also has a first aid training course, and built into that first aid training course is using naloxone and information on OHR. So again, highly recommend taking that training. And then doing your own personal research, as stated about the toolkits, understanding what's available in your province, reaching out and asking for a toolkit, understanding what's available in your region, if there's specialized programs, and anyone from the help desk would be happy to support you and help you through that journey. Those would be what I would recommend, April.
That's great, Kristen. Thanks for that great answer. And I'm also, just in case Kristen or Kayla is, either of you are not able to access the chat, there are lots of folks that are thanking you for the wonderful information, just so well presented, so clear. So Sophie asks, I'm not sure if I understand what the difference is with Quebec. Can we have access for free to naloxone in pharmacies in Quebec also?
I can speak to this question, and I think the best answer I have to this is I believe that it is available. When I was speaking about the funding situation with the Canadian Red Cross's collaboration with St. John's Ambulance, we are providing this service to all provinces and territories with the exception of Quebec, because it was identified that they have their own policies and practices in place. I would suggest that if you are interested, maybe contacting your local pharmacies, maybe looking a little bit more about what those opioid harm reduction toolkits or programs are available in the province of Quebec. I unfortunately don't know this information. I just know that our project doesn't cover that territory. I hope that answers your question.
Thanks, Kayla. And I'm actually seeing someone helped us answer that question in our Q&A box and said that, yes, it is available in pharmacies in Quebec. So
thank you so much for answering that. I appreciate you.
All right. Someone asks, do you know of any school, high school or elementary, that has naloxone in the schools as a harm reduction tool? Is that a common practice?
There we go. There we go. I got her. Actually, I can hopefully speak to this. Now, what we have to understand, first of all, is that education systems are dictated provincially. So what may occur or happen in one province does not necessarily mean it'll occur or happen in another province within the schools. I do, however, having about 15 years experience in schools, know that schools often openly welcome people who have had the proper training, be that the social worker on staff, the counselor on staff, even a teacher who has taken, the extra effort, or an admin staff to have those kids. They do ask that if you bring them, at least in my province of Saskatchewan, they do ask if you bring those kids in and have them available, that you are certified to use them. So I do believe that it is something that's left to the discretion of the provinces. However, I think most provinces would be open to seeing them in schools if handled by a certified person.
That's good information to know. Thanks, Kristen. Someone asks, any thoughts as to why the numbers are so proportionately different in Quebec? So maybe if we have any potential guesses, and maybe we don't have that information necessarily ourselves, but it's a good thing to wonder about for sure.
Kayla, do you have any thoughts on that?
I'm not really sure, honestly, and I don't want to give wrong information or speak out of turn. I would welcome anybody who is on the call that has experience with that. If they could provide answers. I don't want to speculate, of course, based on numbers. Kristen, do you have any ideas?
To be brutally honest, I am a Saskatchewan girl who has never ventured too far in her life and very new to the CRC. As much as I do know about this topic and have tons of information about this topic, provincially, I am limited to my knowledge. And again, I'm with Kayla in the way that I don't want to speak out in a way that would misrepresent the province of Quebec in any way. I'm sure the information is available. And I'm sure there are people and professionals, nurses, teachers, medical professionals that would definitely have that information, and maybe even a speculation as to why.
Thanks, Kristen and Kayla. We have another question, and I'm going to paraphrase it. It's basically asking about oxygen as a method in response to overdose, and wondering if you have any thoughts or insights on the use of oxygen rather than naloxone. Any thoughts, Kristen?
I will say that in my training, the training that I've been able to complete in multiple different areas with multiple different organizations, I have never been presented with the idea of using oxygen in lieu of or addition to naloxone. That being said, everything in regards to this information is constantly changing and growing. That's why we have left our toolkits and our tools as open, growing, and changing products. So as I have only been trained in naloxone, that's been the only information offered to me. Now, what is out there, what is up and coming, what is a possibility? I mean, very much an open-ended situation. Yes, Kayla.
I want to say, first of all, that I'm not a health practitioner or a doctor, so take everything I say with a grain of salt, please and thank you. But I can understand from a theoretical perspective why oxygen would be important, because one of the main impacts of opioid poisoning is that we are not able to get a breath, or we have slowed breathing, right? So I think that there is space to use it in tandem with naloxone. I'm sure, if you're responding to an opioid poisoning and you call the paramedics and they come, then they may provide them with oxygen. I think the impetus here is that as civilians, as people who aren't a part of emergency health services, if you happen upon an opioid poisoning and you need to intervene to save a life, naloxone does this by displacing the opioids that are on these brain receptors that make it difficult for people experiencing this to have a breath. So my best and uneducated guess or advice would be that there is space for both. But when it comes to, getting to the reason why the lungs aren't breathing as properly as they should, naloxone is probably the better alternative. But again, not a doctor, so not professional or medical advice, just a speculation.
Yeah, that's great. Thanks, Kayla. And there are a couple of things in the chat too that can also help folks with what we've been hearing about so far. So if there are any questions specifically about the province of Quebec, we do have a specific query box called hpnp@redcross.ca if you want to ask questions about that. We have our expertise over at that question box. And also, Jem shares that I was told by a pharmacist that naloxone does not do any harm, and in a situation that it could save a life. So naloxone as a life-saving device would be best at the moment. So really interesting
And that's
discussion.
information that's also been shared with me during my trainings as well. So thank you, Jem. I do believe that is very correct information.
So this seems to have sparked some conversation. So there's a lot more that's being shared in the chat, which is wonderful. We have one attendee that has their hand raised. So this is the first time we're going to try this. I'm actually going to allow this person to come on camera and speak if they like. Emmanuel, you are invited to ask your question to our panelists if you desire, or you can share your question in the chat or the Q&A box. So you have the floor if you like.
Thanks so much for the presentation, and so informative, and it will be of better help in my primary assignment. Thanks.
Thank you so much for sharing that with us, Emmanuel. That's very kind of you.
Thanks for joining us, Emmanuel. And I'm going to ask one more question for our audience here. And okay, how can we better involve families and support systems in harm reduction efforts is our last question for our session today.
So I can offer some advice on that. I think that there is a lot of fear around opioid use and addiction. I think that in order for us to be able to support our loved ones who are grappling with opioid misuse, we have to make sure that we understand, you know, what we can do and how we can inform ourselves with information and facts that'll allow us to understand maybe, you know, what the situation is, but also the broader context around it. I would always recommend, you know, familiarizing yourself with support groups and resources, you know, local to your community or local to your province, territory, your nation, you know, any support groups available. But I think, you know, coming from a person who has experienced this in her life, I think that the best thing that you can do is just present yourself as somebody who is approaching it from a place of empathy and not shame. Because sometimes when we talk about addiction, we talk about, you know, the shame that we feel or the guilt that we feel because you know, because we aren't doing enough, or, you know, we got here in the first place, you know, and that's really hard for people to go through when they're struggling with opioid misuse or addiction. So, you know, changing your tone and your language to reflect in your conversations support, right? First and foremost, empathy and support, I think, would be not everything that you could do, but it could be a really good start. So thank you for that thoughtful question.
Well said, Kayla. Thank you so much. And I think that concludes our session for today. We're a minute over, so much appreciation to everyone who joined us today. We hope you can join us for other sessions in our webinar series, and you will be hearing from us with follow-up resources, again, at rrr@redcross.ca. So just one final farewell to everybody. Thank you so much for joining us. Take care, everyone.
Thank you, and have a beautiful day, everyone. Bye.
Have a wonderful day, everyone.